We were talking a moment ago, Ms. Sellers, about the Navigator, and what is a Navigator for someone who receives a cancer diagnosis? Okay,
a Navigator can have several different meanings to different people depending upon who is navigating. Right now throughout North Carolina and throughout the entire United States, we have nurses that are navigators. There are social workers that navigate. The American Cancer Society has a navigation program in which they are actually training people either from the medical community or retired nurses or even cancer survivors to navigate. And then there are also lay navigation programs coming up where people in the community are requesting that they learn more about cancer and what it is and how to support people with cancer in order to help people in their community navigate. The entire philosophy behind patient navigation is truly meant to try to identify barriers to care that would prevent someone from not getting treated. For example, if you're in a rural area and you find out you have cancer and you don't have a job and you have no insurance, you might feel and think that there's nothing available, yet working with the right person who is educated about not only community resources, state resources, can actually guide them to the appropriate organization and try to help them get the help that they need in order to receive the care. The basic principle behind navigation is to ensure that patients and families don't have to go through this diagnosis of cancer alone. And it's to have someone there that is educated and that can help them, whether it's the professional navigator, such as the nurse, to know the resources, to know about the disease, to know about the clinical trials, and to help them understand their options and to be an advocate for them.